Welcome to this presentation. Today we're going to be looking at the Medicare Enhanced Primary Care Program. We will provide an overview of the program, describing the populations that access speech pathology services in this scheme, looking at how vulnerable populations and Aboriginal and Torres Strait Islander people are considered in this scheme, and appraising it in its facilitation of efficient and effective speech pathology services. The Medicare Enhanced Primary Care Program is a funding scheme established by the Australian Government to aid patients in reducing the costs of their allied health services under Medicare. It was designed to help document and plan the overall treatment plan for people with chronic health conditions and complex medical conditions. Introduced in 1999, it aims to improve the coordination and management of care for eligible individuals, promoting an integrated approach between allied health professionals, specialists, and general practitioners. The EPC program emphasises early intervention and preventative care, aiming to reduce the progression of chronic illnesses. Eligible patients can gain access to a range of allied health services through this scheme, such as speech pathology, occupational therapy, physiotherapy, podiatry, dietetics, psychology, and more. These can be one type of service or a combination of different types of services. Through providing a foundation that promotes multidisciplinary care, it aims to address the diverse needs of patients with complex health conditions, minimising the burden on the healthcare system and improving their overall quality of life. For patients to qualify for the program, they must meet specific criteria outlined by the Australian Government. Once enrolled, patients can access 5 rebated consults to any referred allied health practitioner per calendar year. These services are delivered by registered allied health professionals who work in conjunction with the patient's general practitioner to ensure coordinated care. The services covered under the EPC program vary from patient to patient depending on their individual needs. Services may include consultations, assessments, interventions, and ongoing monitoring focused on improving health outcomes and quality of life and ensuring the patient's ability to self-manage their condition. Individuals with terminal or chronic medical conditions lasting for a period of at least 6 months are eligible. Their condition also has to require ongoing management from a multidisciplinary team. Patients must have a GP management plan and team care arrangements in place, which is developed in collaboration with their primary general practitioner, outlining coordination of care and the patient's health goals and treatment strategies. The referring medical practitioner will decide the number and combination of services that are appropriate for the patient and whether the patient's chronic condition would benefit from allied health services. Fundamentally, the program operates within a framework of communication and collaboration among healthcare providers. General practitioners play a key role in coordinating care, liaising with allied health professionals to ensure that assessments and interventions align with the patient's agreed upon treatment plan to ensure consistency of treatment. Through this communication, a holistic approach to patient care is facilitated to address the physical, psychological, social, and functional dimensions of health. The program promotes better health outcomes for patients while reducing the healthcare costs and optimising the use of healthcare resources associated with preventable complications that are experienced by patients with chronic illnesses. Through advocating for timely and targeted interventions, the program seeks to minimise emergency department visits, hospital admissions, and other costly healthcare services, supporting the overall sustainability of the Australian healthcare system. The Medicare Enhanced Primary Care Program is a significant step towards enhancing the management of chronic and complex health conditions in Australia, providing funding support for allied health services and promoting communication and collaboration amongst healthcare providers. The program aids patients in managing their conditions and enhancing their overall quality of life. As a new graduate speech pathologist, you will encounter EPCs when working with a range of patients and when engaging in multidisciplinary care.
Next, we will discuss how EPCs facilitate access to speech pathology services for diverse populations in Australia. The EPC scheme serves as a critical avenue for individuals with chronic or complex health needs to access allied health services, including speech pathology. A population can be defined as any complete group with at least one common characteristic present. Therefore, it is essential to recognise that populations accessing speech pathology services through EPCs encompass a wide spectrum of individuals, each with unique needs and circumstances. Let's start by examining the key populations benefiting from speech pathology services under the EPC scheme. Firstly, we have the population of children with developmental delays or disorders. This population may access services as a result of circumstances such as ASD, intellectual disabilities, language delays, or speech disorders. Speech pathology services for these children may involve assessments where speech pathologists utilise a variety of standardised tests and informal observations to assess speech, language, and communication skills. These assessments may include evaluating expressive and receptive language abilities, phonological awareness, and pragmatic language skills. Individual therapy sessions are tailored to address the specific needs of each child through techniques such as play-based therapy, PECS, or AAC to enhance communication skills. Speech pathologists should include collaboration with educators and/or caregivers to implement strategies and techniques that support the child's communication development across various settings. Then we have adults with neurological conditions, which include stroke, traumatic brain injury, Parkinson's disease, or dementia, who may seek services for speech and swallowing difficulties. This encompasses assessment to evaluate speech, language, cognitive communication, and swallowing function. This may include conducting oral motor exams and swallowing examinations, instrumental assessments such as video fluoroscopy, and cognitive communication assessments to identify areas of impairment. Therapy delivery may focus on improving communication and swallowing function, addressing issues such as dysarthria, aphasia, dysphagia, and cognitive communication deficits. Speech pathologists also provide education and support to caregivers with strategies for facilitating effective communication and safe swallowing at home. This may involve training in mealtime management, dietary modifications, and techniques for optimizing communication interactions. Next, we have individuals with voice disorders who may seek speech pathology intervention as a result of vocal nodules or vocal cord paralysis. Speech pathologists may deliver comprehensive voice assessments to evaluate audible vocal qualities. Assessment tools such as the CAPE-V and acoustic analysis may be used to assess vocal function. Therapy sessions focus on improving vocal function and reducing vocal strain through exercises, breath support, etc. Techniques such as vocal hygiene education may be incorporated into therapy programs. Speech pathologists can collaborate with other medical professionals to ensure comprehensive management of voice disorders. This may involve providing pre- and post-operative voice therapy for individuals on treatment plans for conditions such as laryngeal cancer. Next, we have the population of individuals living with swallowing difficulties. Individuals with dysphagia, often associated with conditions like stroke or head and neck cancer, require specialized speech pathology input. Speech pathologists conduct thorough swallowing assessments to evaluate oral, pharyngeal, and esophageal swallowing function. This may include clinical swallowing evaluations. Therapy programs are tailored to address specific swallowing impairments and may include exercises to improve oral motor strength and coordination, compensatory swallowing strategies, and diet modifications. As a result, they can provide recommendations for safe swallowing strategies to minimize the risk of aspiration and ensure adequate nutrition and hydration. This could be done through modifying food and liquid consistencies or using adaptive feeding utensils. Lastly, we will talk about the population with speech sound disorders who may access speech pathology services. Service delivery for this population may include assessments such as the DEEP, which identifies specific speech sound errors and underlying phonological patterns. This may involve assessing articulation, phonological processes, and speech intelligibility. Therapy sessions are delivered to target the identified articulation errors, phonological patterns, and motor planning for speech sound production. Techniques such as auditory discrimination training, modelling, and phonological awareness activities may be incorporated into therapy sessions. Speech pathologists collaborate with educators, workplace professionals, and other relevant stakeholders to support functional communication skills in educational or work setting.
In Australia, the Medicare Enhanced Primary Care Program plays a crucial role in supporting vulnerable populations, including Aboriginal and Torres Strait Islander people, by providing tailored healthcare services. These services may include chronic disease management, allied health services, and multidisciplinary care coordination. For instance, individuals with chronic conditions such as diabetes, cardiovascular diseases, or respiratory illnesses can benefit from the EPC program by receiving tailored care plans, regular checkups, and access to allied health professionals such as speech pathologists, physiotherapists, or dietitians, just to name a few. This program recognises the unique healthcare needs of these communities and offers specialised care to address them. So let's consider these vulnerable populations and how the EPC scheme delivers services to address health inequity. Elderly people are considered a vulnerable population due to their susceptibility of illnesses and potential loss of independence due to health constraints. The EPC program may offer services such as chronic disease management plans, which provide coordinated care for conditions like diabetes, arthritis, or heart disease, ensuring elderly individuals receive comprehensive support. Service delivery may include regular home visits by healthcare professionals for health assessments, medication management, and assistance with activities of daily living. Additionally, access to geriatric specialists or geriatric case management services may be provided to coordinate care across multiple healthcare providers. Individuals with diabetes are often considered a vulnerable population due to the intersection of societal barriers, discrimination, and the increased likelihood of facing obstacles in accessing essential health care services and opportunities. Therefore, EPC services for individuals with diabetes are aimed at improving functional abilities and overall well-being. Services may encompass assistive technology assessments and provisions such as a wheelchair stair platform lift or devices for alternative communication, personalised care plans developed with input from multidisciplinary teams, and access to specialised rehabilitation services such as physiotherapy, occupational therapy, and speech therapy. Low-income individuals are also considered a vulnerable population because they often lack resources and face heightened challenges in accessing adequate healthcare, education, housing, and other essential services, which can exacerbate social and economic disparities. For those facing financial constraints, the EPC program may provide access to subsidised allied health services like speech pathology or dietetics, enabling them to manage chronic conditions effectively despite financial limitations. Service delivery may also involve subsidising the cost of prescription medications, medical equipment, and supplies. Additionally, transportation assistance to medical appointments and outreach programs provide free health screenings and preventative care services could be provided. People with mental health issues are considered a vulnerable population due to the stigma, limited access to effective treatment and support services, and the potential for discrimination in employment, housing, social interactions, which can all exacerbate their vulnerabilities and undermine their well-being. Mental health patients can also receive the EPC scheme, where the service delivery may include subsidised access to mental health professionals such as psychologists, psychiatrists, and counsellors. This could involve therapy sessions, psychiatric evaluations, medication management, and intervention services. Within the EPC program, Aboriginal and Torres Strait Islander peoples emerge as a particularly vulnerable group, characterised by the distinct culture and health requirements. Service delivery within this framework necessitates cultural sensitive approaches, including the engagement of Indigenous health workers or cultural advisors in conducting health assessments. These assessments are often conducted in culturally appropriate settings, incorporating traditional healing practices, ceremonies, and storytellings to ensure a comprehensive understanding of individual needs. Additionally, dedicated Indigenous care coordinators play a pivotal role in facilitating culturally safe and holistic care by mediating between healthcare providers, community organisations, and Indigenous elders. They oversee tasks like arranging transportation to appointments, advocating for patients' needs, and ensuring seamless coordination of care. Furthermore, community-led promotion initiates forms of an integral part of service delivery, offering culturally tailored programs such as nutritional workshops, physical activity programs, and smoking cessation support groups. These initiatives often collaborate with local Aboriginal medical services or community-controlled health organisations to maximise and reach their impact. Moreover, improving access to Indigenous health workers within mainstream healthcare services or establishing Indigenous-specific health clinics staffed by Indigenous healthcare professionals is crucial. These professionals offer culturally sensitive health education, advocacy, and support services addressing the unique health challenges faced by Aboriginal and Torres Strait Islander communities.
There are a range of positive aspects of EPCs. First and foremost, EPCs allow for improved access to care. This is because many disciplines who would otherwise have little contact with each other are covered under one plan, for example, speech pathology, podiatry, and dietitians. EPCs are also prescribed by a GP, which is helpful for families and clients who are unfamiliar with the health system. A GP can assess the needs of a client and then identify which services they would benefit from and refer them for these. This is very important, as families and clients living in Australia can be unaware of the kinds of supports that are actually there for them to access, and what areas the client actually needs support in. EPCs also promote better coordination of care, as various healthcare providers all coordinate to offer services under an EPC. This means speech pathologists can coordinate with other providers such as physiotherapists easier, as all details for supports are included in the one plan. EPCs are also a way that families and clients who have difficulty paying out of pocket for services can receive support paying for them if client needs are chronic. EPCs are especially helpful for clients who do not have NDIS funding to have sessions at a more affordable price. Although the whole session cost is not covered, they will receive a rebate from Medicare for a portion of the service, which can help relieve families of financial burden when paying for various expensive supports. Further, once the assigned number of sessions have been used, each provider is required to write a summary letter for the GP, revising the services provided and progress made in that time. This means that providers are potentially more focused on the client and their goals and reviewing outcomes whilst under the EPC program in order to make progress in a maximum of 5 sessions. Therefore, client care can be promoted under an EPC, as clinicians may be more motivated to make progress in order to write a summary letter. However, there are also a range of disadvantages that come with EPCs. As an EPC only covers a maximum of 5 sessions, it is questionable how much progress can really be made in this time, especially when considering the treatment of chronic patients. Generally, patients with ongoing needs will be seen by a speech pathologist for a long time, and as an EPC only provides 5 rebated sessions per year, this is not many sessions in light of the whole of their care. Therefore, whilst an EPC may provide some financial support, there is not a lot that is actually covered in the bigger picture. Further, as there are only 5 sessions given in total, if a client needs multidisciplinary support, they will possibly only have 1 or 2 sessions per support. This means that there could be only 1 or 2 speech pathology sessions covered by their EPC, which is a very small amount and not much time for any real progress to be made. Another consideration is that clients only receive a $58 rebate for speech pathology sessions, which doesn't cover the whole session cost. As such, they are still paying out of pocket for a large portion of the total session price, as speech pathology and other allied health sessions are quite expensive. Parents or patients can be paying over $100 out of pocket, even with the rebate price. So it begs the question of how much financial support an EPC really gives if they are still paying for over half of the session out of pocket and only 5 sessions are being covered. Further, whilst many disciplines are covered under an EPC program, it's important to consider that not all specialists participate in the EPC scheme. Clients will therefore need to confirm what services they need to access and whether this is covered under an EPC. Also, if a client is receiving speech pathology services and being seen under an allied health assistant program, an EPC cannot be applied to these sessions, as the therapist does not have their own provider number yet. This is an important consideration for clients who are seeking to use an EPC but are currently being seen under an allied health assistant due to long waitlists. EPCs are also only prescribed by a GP for chronic management, meaning many families and clients will not have access to an EPC if their needs are not chronic. Thus, they are unable to access session rebates when potentially under financial strain.
Thank you for watching. We hope you have learned some more about the Medicare Enhanced Primary Care Program and feel ready to engage with it in your future practice as a new graduate clinician.